Hi, my name is Sierra Perkins, and I'll be doing my oral presentation on elderly abuse in nursing homes. I would like to start off with a statistic that says that between 1 and 2 billion Americans over the age of 65 have dealt with a miscare or mistreatment by a care facilitator or someone that is a caretaker. Elderly abuse is a topic that some businesses of long term do not like to discuss. With over 30% of nursing homes nationwide, there are 10% of abuse cases that are reported each year. That is a huge number for the amount of elderlies that are getting abused. So their cases of elderly abuse can ruin the facility and the lives of other victims, whether the elders are being abused by other elders, staff members, or even family members. It's still a serious issue that we should definitely be looking into. For the purpose of my oral presentation, I would like to look specifically on various abuse cases in nursing homes in Nashville, somewhere where we actually are and where this is actually happening, as well as special care units that take care of elders that don't get to see as many visitors and how much they actually get abused in there. So this is like I said, this is a very huge issue that I feel that really needs to be discussed. One of the forms of abuse that can be considered in these nursing homes that have been documented is physical abuse, of course, which is causing pain or injury to an individual, showing physical marks. There's also psychological abuse that can be a harder form of abuse that can be hard to report just because it's an emotional pain, but it does not mean that it is less of anything else. It is sometimes very hard to identify, like I said, but it is still holds very much weight as physical abuse would. There's also sexual assault abuse, which is more controversial in these nursing homes. It actually happens a lot more, which is pretty sad. A lot of victims do not like to report sexual assault just because they feel ashamed and just because they don't think that that can happen to them for someone who's actually taking care of them. The material of exploitation involves misappropriation of elders' money sometimes. That's also a form of abuse, is someone in the caretaking facility is taking money away from them or starving them. This is all mental abuse. This is all abuse. So this is just a lot of things that happen in these nursing homes. Sometimes when a caregiver is stressed out, it can give a greater chance of occurring abuse. That is not any reason for someone to have abuse, but these are some of the reasons why cases have shown. They have asked caretakers why have they abused, and a lot of them have said that it's because they're in a high stress level environment, and sometimes they're dealing with a lot of hardships and they kind of take it out on the patients, which is definitely just not okay. With around 50% of all nursing home residents having someone in there that is sick, they are more likely to have someone that take care of them. For instance, there are patients who have dementia and they sometimes cannot remember some things. Dementia patients are more likely to be more abused just because they cannot remember who you are, and they're more likely to take advantage of, which is something that is not good, but it does happen. Now, with that being said, there are residents in nursing homes that speak up for themselves and that give the opportunity to do resources. So when I have said that sometimes in certain abuse, some elderly do not like to report it just because they don't like to say that someone that they care for them is harming them. Yes, there are some that are actually reporting, and that is the reason why we have our statistics today, because we can actually say that 10% out of 30% of nationwide nursing homes, there are elderly that are being abused daily. So with that being said, there are about 4 elderly right now that are being abused. as we speak. It can be unclear when a person is being abused sometimes. Like I said, that the psychological abuse, sometimes you cannot catch it as fast as you would be able to recognize physical abuse because you would have a mark. But the top two forms of allegations from the Nashville Department of Aging is one, like I said, physical abuse and sexual assault. There are two main reasons why a lot of facilities sometimes do not report it to the police. Is one, because they're sometimes overstaffed and they take advantage of the workers that they do have when they're taking care of these patients. So sometimes the justice for the patients are sometimes not being served, and that is really sad, just because this is somewhere where we put our elderly for them to, get help or seek treatment sometimes that we sometimes cannot take care of them, and to find out that they're actually being abused and being manipulated from their things every day is just not a good sign. While elder abuse can be called many things, there is also elderly abuse amongst other elders as well. So sometimes there's not even just caretakers who abuse them, but there are other elderly that abuse them. And this sometimes can be seen as acting out, aggression. Sometimes, like I said, dementia patients, they have certain manic episodes where they don't really remember anything, and they don't remember what they're doing, and they kind of just forget a lot of things. So that sometimes feeds on the cycle of abuse. And if a resident hits another resident and it causes an injury and they yell to get the caregiver, sometimes there's nothing really can be done because both of them have to live there, and then that causes more issues because no one has resolved the issue. Even if an abusive resident chooses to transfer out of a nursing home, they still have to require care, and they must go to a different facility. But with that being said, since the statistics is so high of elderly abuse in all of these nursing homes nationwide, sometimes you can take someone out of a facility and sometimes they can still receive abuse in another facility. With my research it shows that sexual assault and psychological abuse and physical abuse has really been a big controversy, and our nation does not really know how to handle the problem at hand. And I feel like that is something that we need to really work on, just because this is our nation, this is our people, and I feel like we need to figure out a way for us not to harm our people at the same exact way. So I have been looking into a lot of long-term care facilities in Nashville, and they have a good system set up to where if an elderly has reported abuse with a caregiver or another elder in the that's a resident there, they go through a proper procedure where either the caregiver is immediately fired after a proper investigation has been filed, and as well as for the other resident, they will isolate the other resident away from the other resident. Sometimes that this is kind of a controversy as well, just because you take a resident that has been harming another resident, put them somewhere else, they're still going to be around someone else to do the same thing. So I feel like this is an issue that's really stuck at hand, because we're kind of tied on what to do, just because we can't kick the elders out of the nursing home, but we cannot isolate them to where they are not around anyone. So I do feel like this is something that our nation has been battling for a long period of time. They have made a lot of events and a lot of programs that help victims who have been abused, and as well as victims who have, or there's people who have been abused in these nursing homes, and just a way for them to de-escalate stress and to just teach them that there are other ways for them to release their stress, so they will not have to take it out on either the patients or the other residents as well. The Medicare system has also set up a nice program for the nursing home patients, just for them to actually learn about what is the sign of abuse, and if you have any discrepancies or if you feel like you are being abused, please report it and it can be handled at hand. And I do think that is a really nice program that they are trying to start, just by reaching out and telling some elders that they are being abused, because sometimes some elders don't realize that what they are going through is abuse. Like I said before, psychological abuse, sometimes you can't really realize it, but yelling at someone and belittling them is a form of abuse, and sometimes they don't recognize that that is abuse. So I like that they actually have a program where notifying them the signs and letting them know that if this is happening, you can file a report and a proper investigation can be done for that situation to be at hand. So I do think that is something really nice that the government has started, well, the state have started. I feel that elderly mistreatment is a recognized social problem that is increasing. It's increasing drastically, and I hope that one day that it can actually be resolved all at hand, but I do feel like there is a lot of work that needs to